Hello, I'm Dr. Alistair McNeish, and today I'm going to show you how to do the rat aorta practical. This is a practical we do in the second year of the pharmacy course at Reading School of Pharmacy, and it's in module PM2C. Okay, so this is the equipment we're going to use today. It's called a myograph. Basically, it's an organ bath where we have a physiological salt solution, and this organ bath is connected to a force transducer, and that allows us to measure how much the arterial ring constricts or relaxes. That force transducer is attached to this box over here, which converts the signal for the computer, and then it's just simply displayed on the screen. So we can see the contraction, relaxation on the screen. So let's look at the organ bath in a little bit more detail. So this is the myograph. It has several components. Essentially, if we look at the area here, this is the side that's attached to the force transducer. The other side here is attached to a micrometer. So looking even closer, hopefully you can see these two pins, and the ring of artery is going to sit over those two pins. And we need to stretch the tissue by moving the micrometer outwards, like this, in order to apply the amount of stretch that the artery would normally experience in the body. And obviously the micrometer, you can also move the pins closer together as well. In order to keep the tissue alive, we also need to bubble this physiological salt solution. And so if I just turn on the bubbling now, we can see there's a gas which is a mix of oxygen and carbon dioxide, and that will supply the tissue with oxygen, but also provide carbon dioxide to help keep the physiological salt solution at the correct pH to keep the tissue alive. Before we start the experiment, we need to calibrate the myograph. So normally between the two pins, the artery would be sitting around them, and essentially it would be pulling or trying to pull the pins together when it contracts. But we need to tell the myograph how much force is being produced. So we first calibrate that by using this balance-like device, which will push the pins together and give us a calibrated reading on the force transducer. So I'm now just going to add the 1 gram weight to the balance so that you can see that happening. We leave that there for a couple of moments and then remove the weight again. Now we're going to mount the tissue. So we're going to put it on the 2 pins. So we just need to turn the bubbling off for a second. So now I'm just going to try and get the artery over these 2 pins. And it's over the 2 pins now. And we're just going to stretch this a little bit, but not too much, but just enough to keep the artery on the pins. And to keep the tissue alive, we'll start the bubbling again. And so the next process we'll do is to stretch the tissue in a controlled way to the equivalent amount of tension it would experience in the body under normal blood pressure. So for the rat aorta, that's around about 10 millinewtons of tension. So just by using a micrometer, I can stretch that tissue to 10 millinewtons. Now you can see that the artery looks very stretched out compared to before, and it's less like a ring and more flat between those 2 pins. This means that the artery can't actually physically move, but it exerts force upon those pins, which we can then record. If you look in your workbook, you'll see that for this concentration response curve, we're going to add a series of final bath concentrations. So I'm just going to write a few of them on the board here. The first concentration we're going to add is 1 times 10 to the minus 9 molar. And we're going to use here a working stock of 1 times 10 to the minus 6 molar of acetylcholine. And so if you do the molar calculation for this, bearing in mind that the myograph I'm showing here is a 5 ml organ bath, you will be using a 50 milliliter volume in your calculation. So I would be adding 5 microliters into the bath. So what that means is I'll be adding 5 microliters of this concentration to give me this final bath concentration. So the next concentration we add to the bath would be 3 times that amount, which is 3 times 10 to the minus 9 molar. And again, using the same working concentration, the working stock concentration. Now, if you did the molar calculation of how much of this to add to the bath, or simply did the calculation in your head, you would say, well, if I added 5 microliters before, then I would need to add 15 microliters of this solution. However, we've got a problem because inside the organ bath, we've already added this volume of the solution. So that means because we're taking account of the concentration already inside the bath, we actually only add 10 microliters because 5 plus 10 gives us the final volume equal to 15 microliters. So we've accounted for the volume that's already within the bath. The next step is a little bit different. So if you look in your table, the next concentration we add is 1 times 10 to minus 8 molar. And this time the working solution we're going to be adding is 1 times 10 to the minus 5 molar. We notice this is 10 times more concentrated than this. This working stock is 10 times more concentrated as well. So if you did the molar calculation to achieve this final bath concentration, again, you would add 5 microliters. But that's not taking into account of the volume of the previous stock you've already added into the bath. So we have the equivalent of 1.5 microliters of 10 to minus 5 already in the bath, because 15 microliters of this stock, this is 10 times more concentrated, so we have the equivalent of 1.5 microliters already in the bath. So we only add 3.5 microliters of this concentration into the bath. Then the pattern, as you work down your table, gets a little bit easier, because we now no longer have to do any form of calculation. We just follow the pattern. So that's 1 times 10 to the minus 5. And then we'd add 10 microliters, because again, we've got the equivalent of 5 microliters in the bath. Add another 10, gives you the 15, and so on as you go down. And this is really important concept, because when you imagine giving a loading dose of a drug to a patient, you need to account for the dose you've previously given the patient. You don't just add what you think would be the appropriate dose without thinking about what the patient has already had. This slide shows you how to adjust the concentration to account for the concentration that is already present in the organ bath. First thing that I'm going to do today is actually check that my piece of aorta is working. So I'm going to take the serial dilutions that we made earlier. I'm going to take the phenylephrine, take the appropriate volume, and here I've taken a volume that will give me a final concentration of 100 nanomolar, and I just place that into the bath, into the solution, and pipette to dispense the fluid. I then add the comment to say that I've added a concentration of 100 nanomolar of phenylephrine into the bath. Now we wait to see if we see a constriction. And hopefully now you can see that after I've added phenylephrine, the tissue has begun to constrict a little bit. That amount of constriction is quite slow, so I'm going to add some more phenylephrine just to get a little bit more constriction. And we can see the artery is now constricting quite nicely to phenylephrine, and I'm going to let that start to level off or plateau, and then I'm going to add a single concentration of acetylcholine into the bath in order to test if the vessel can relax. Just adjusting the pipette to the correct volume. And here I'm adding a concentration of 1 micromolar of acetylcholine. So again, adding the comment. Tip. And now the acetylcholine has been added into the bath, and we can see that we're beginning to relax or move the line is moving back down towards the baseline before we added phenylephrine. And normally, if acetylcholine can relax 75% of this tension induced by phenylephrine, or if it can relax 75% or more, then we will accept that this tissue is healthy and that the endothelium is intact. And here you can see this relaxation is probably a little bit more than 75%, and it's still continuing to relax. So we say that that tissue is okay to use. So now we just simply wash out the organ bath and replace the Krebs solution with Krebs solution without drug. And we'll then be ready to start the experiment. So wash once, twice, and then 3 times to make sure that we've washed out any of the phenylephrine or acetylcholine that was in the organ bath. So here on the screen is what we did earlier. This here is the baseline where we had no drug, and here is where we added the first concentration of phenylephrine. And we can see it caused a little bit of a constriction, but not so much. So I just tripled the concentration here to 300 nanomolar, and we can see this really nice constriction. And where it was beginning to plateau, where this dotted line is, we added acetylcholine, and you can see that the acetylcholine caused relaxation of that phenylephrine induced tone. This messy part here is where we washed the bath out several times, and if you can just see at the end there, you can see that it's now returned to the baseline without the presence of the drugs. So now we know the tissue is working, we're ready to do the full experiment and the concentration response curve. So we're now ready to do the concentration response curve to acetylcholine. Exactly as when we tested the tissue, this is the baseline here, and here's where we added the first concentration of phenylephrine, and there wasn't much response. The second concentration of phenylephrine, 300 nanomolar, caused quite a big contraction. And here you can see that that contraction has begun to reach a plateau. That's leveled off. We then began to add increased times 10 to the minus 9 molar, and we can see perhaps a small response to acetylcholine. Increasing to 10 nanomolar, or 1 times 10 to the minus 8 molar, we can see we've got quite a big relaxation there. And 30 nanomolar, or 3 times 10 to the minus 8 molar, again, there was a small increase on that relaxation. As we continue to increase the concentration, 100 nanomolar caused the relaxation, and we can see that the relaxation is becoming more stable now as it gets bigger. 300 nanomolar actually caused a very profound relaxation that looked like it was remaining stable, and as we added 1 micromolar or 3 micromolar acetylcholine, we couldn't elicit any further relaxation. So what we have here is a full concentration to response curve for acetylcholine. So we've done the concentration response curve to acetylcholine, and we've got a nice relaxation. So now what we're going to do is add a drug called L-name into the bath. That's L-N-A-M-E. Now L-name is a drug that is a competitive inhibitor of nitric oxide synthase. So we want to see what effect this drug has on the relaxation response to acetylcholine. But before we look at that response, we just let the tissue equilibrate with L-name for about 20 minutes. So we're adding L-name before we start the next concentration response curve. So here we have the baseline. Now, if you remember, the drug L-name is already in the bath, and L-name hasn't caused any kind of constriction on its own. When we added phenylephrine, we started at the low concentration of phenylephrine, 100 nanomolar. Now, if you remember, that didn't cause much constriction in the control concentration response curve, but in the presence of L-name, it's caused a very large constriction. And that is to be expected based on the nature of the activity of L-name, and there'll be some questions in your book that might ask you about that. So you can see that phenylephrines cause constriction, and now when we add acetylcholine, 1 nanomolar, 3 nanomolar, 10 nanomolar, 30 nanomolar, there is absolutely no relaxation. And if you remember, 30 nanomolar was causing relaxation before. It's only when we add 100 nanomolar we do see a relaxation to acetylcholine, but adding more acetylcholine, 300, 1 micromolar or 3 micromolar, does not cause any real increase in relaxation from 100 nanomolar. So it's quite obvious that the relaxation to acetylcholine is inhibited. When we added the other drug, sodium nitroprusside, at 1 micromolar, what we got was a full relaxation of the phenylephrine induced tone. And that means that nitric oxide released from sodium nitroprusside can still cause full relaxation of the tissue. So L-name doesn't prevent this tissue from being able to relax, it just blocks the relaxation to acetylcholine. And again, an explanation for that is in the study questions in the workbook for this practical. The way that you will measure the data is slightly different. If you just follow the instructions on screen, then you will analyze the data correctly. But I'm just going to take you through how we analyze the data. So what we do is we select an area down here. This is the baseline before phenylephrine is added. And what I'm doing here is just adding this data to the data pad. So you've not seen me do that, but trust me, I've added that data to a data pad. And then we're going to measure the maximum amount of constriction produced by phenylephrine. Okay, so we just, again, the line's quite wobbly, so we're going to take an average by selecting that block, and again, add that data into the data pad. So that data is now in the data pad. So now we just do the same. We measure the amount of relaxation at each point. So that's 1 nanomolar. Again, just taking an average, that's 3 nanomolar. Now you can see here we've begun to get relaxation. So where we don't have this wobbly line, we just tend to take the average of the maximum response. And we just do that for every concentration. And what we're going to do with this data, so I've now collected all the data for the maximum relaxation, we're going to express the percent relaxation of acetylcholine, and that's the percentage of how much it relaxes between this baseline and the maximum constriction value. So these values of relaxation will be expressed as a percentage of that total vasoconstrictor tone. And we just repeat the process for the data in the presence of L-name. Okay, so now I've opened the data pad, and what we can see here is this is our comment text, and this is the data that I just recorded. So here is the tension before I added phenylephrine, and this is the tension after I added phenylephrine. So the amount of constriction that there is possible is the difference between these two numbers. So that's about 11 millinewtons. But here you can see the relaxations when we've added acetylcholine. So as the concentration of acetylcholine increases, we can see that this amount of relaxation, the amount of tension that's present is heading back similar to the value before we added phenylephrine. So we're going to express this, the amount, the difference between this number and the baseline as a percentage of the difference between these two numbers up here. And we're going to do that in a semi-logarithmic plot of the concentration as well. And I'm going to show you that, what these curves look like in a separate program, and it will be automatically plotted for you in the LabTutor workbook. Okay, so LabTutor will have graphed this for you, and that will be also in your worksheets on LabTutor. And this is the data from today's experiment. So again, your experiment will look a bit different. So what we've done is plot the relaxation to acetylcholine versus the concentration of acetylcholine. So the amount of relaxation is the y-axis, the concentration is the x-axis. Bearing in mind that this is a logarithmic scale, and that's how it will also appear in the LabTutor handbook. So here we can see as we increased the concentration of acetylcholine, we've not quite got the perfect sigmoidal curve, but you can, if you use imagination, see that that is a sigmoidal concentration response curve. If we then look In the presence of L-name, the response to acetylcholine, which is shown in the squares here, as we saw in the experiment, you can clearly see that there's very little relaxation produced by acetylcholine in the presence of L-name. So you can see that L-name has almost completely blocked the relaxation produced by acetylcholine. Today we've done the rat aorta practical. The data that you've used on LabTutor is from the rabbit aorta, but the principles are the same. So we did 2 concentration response curves to acetylcholine today, a control concentration response curve in the absence of any other drugs, and we saw that acetylcholine produced concentration dependent relaxation. We then repeated that relaxation in the presence of L-name, and we saw that the relaxation produced by acetylcholine was almost completely blocked. But when we added sodium nitroprusside, we found that we could still evoke 100% relaxation. So now it's up to you to go to the workbook on LabTutor and complete the study questions.